Hi, welcome to the South Asian Public Health Association Spotlight Series, the platform where we spotlight the remarkable journeys and career trajectories of trailblazers in public health with a special emphasis on the South Asian community. We're your hosts, Samira, President of the South Asian Public Health Association, or SAPHA.
SAPHA, and Aisha, Vice President for SAPHA. SAPHA is an organization dedicated to advancing the health and well-being of South Asians in the U.S. and the communities in which they live, and has been instrumental in fostering collaboration, advocacy, and research to address health disparities and promote equitable health outcomes. Today marks a special occasion as we continue a series of interviews commemorating the 25th anniversary of SAPHA. As your hosts, we are thrilled to delve into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
So our seventh episode features a previous SAPHA president, Ami Shah. Ami is a data-driven public health professional with extensive experience in addressing health disparities. She has worked with the Los Angeles County Department of Health Services to integrate community health workers into primary care for high-risk patients and has contributed significantly to health equity initiatives at the UCLA Center for Health Policy Research and the Sinai Urban Health Institute. We're honored to have Ami Shah here with us today. So Ami, welcome to the SAPHA Spotlight Series. Before we dive into SAPHA's journey, we'd like to start with a glimpse into your own path in the field of public health. So would you be able to share a brief overview of your journey in public health so far?
Sure. Thank you. Thank you. It's such an honor to be here. So I want to just thank you both and for the invitation and for leading SAPHA these days. It's really great to see how much it's evolved since I've been there, and can't imagine 25 years. It's pretty impressive. So my path, it's been windy, I would say. I have, started in my career started working in international development, really. I had, you grow up in America and people, you are associated with being Indian, right? Parents come from India and people call you Indian your whole life. And I had never been there. So I told my parents after I graduated from college that I was going to India and I wanted to do service while I was there. Fortunately, was able to find a fellowship. And that took me to Gujarat, which is where my family's from. And I worked with the Self-Employed Women's Association. It's a women's union in Ahmedabad. And I was just really inspired by the women that worked there and ended up being mentored. Actually, I call her my mentor. I don't know if she formally thought of it that way. But I worked with these trained birth attendants who at the time were delivering babies and part of the informal sector. So the whole women's union was, on the premise of it was to make sure that the formal sector could recognize or find a way to incorporate the informal sector, which was not being paid for. And yet they were contributing to society and health. So I ended up evaluating their training, which was for trained birth attendants, to become certified midwives. It was so empowering for me to see these women in rural India and to see what they were doing with their lives. So I was pre-med bound and ended up kind of getting diverted into this space of public health, which I didn't even know much about. I didn't know it was a field. I didn't know it was a thing. Mirai Chatterjee was is now the president, and at the time I think was leading their health work. And she had gotten a public health degree from Hopkins. And so it was because of her that I really got into public health. And, and after the fact, as I was taking my classes at the university, we were doing focus groups and, formal trainings and evaluations and frameworks. And I realized, wow, that's kind of what I did, right? Like I didn't know at the time that's what it was. When I applied to public health school, I think there were 12 accredited schools across the nation. It's a lot more now. And it was kind of it really wasn't a field the way that at least I didn't know about it when I was in college, right? I went to the University of Chicago. It was very driven by specialty care and getting into medicine. And so the idea of population health and caring for communities in a way of uplifting them, and really for me, realizing the economic power and the economic development that's needed to empower women so that they can take care of their health, for me was what drove me to what I've been doing, I think, my whole career. So I started there, came back to the States, and like I said, I got my public health degree, and then got a job with international development. In that same phase, working on training of upskilling communities where there wasn't as much access to healthcare, right? So these trained birth attendants were obviously providing a health service and yet weren't recognized for it. So being certified as a midwife, that evaluation actually led to a state certification over time, and now it's a national program, which I was so thrilled to hear about 10 years later. And so that's what I was doing in the US. I worked for an international development organization with USAID money, and we were, as USAID money was going abroad to upskill providers with access to contraceptive services. As part of the evaluation team as well. Over time, and at this time, there wasn't the same connections that you can have. As you know, we have Zoom and stuff like that. That really wasn't available then. So I felt very disconnected from the work. We would travel to countries and you'd be there for like a week or two at a time. And, what they call development was always like, okay, here's what you should do. And it never felt like there was this community engagement, that same experience that I had when I was in India, where I felt a part of something bigger as part of a community. It was often like, you try to engage and then you come back and, report back to the government. And so the idea of development was a little different for me, I guess I should say. So over time, we were counting trainings, counting the number of this, counting the number of that. Over time, I realized that I wanted to be more connected to community. And so I had my resume circulating, which I guess is a way people can get jobs. I don't know, still potentially through networks. A friend of mine called and said, hey, so-and-so, your resume was, across my desk and from so-and-so. And he's like, would you be willing to come out? We have a Robert Wood Johnson grant to work on disparities in Chicago. So I flew out, and I remember very specifically, like I took the train from Midway, for those of you who might be in Chicago, to the southwest side at Sinai. And on that train ride, I saw people play, like kids in their backyards, playing in tubes, and there was like water everywhere. And I just remember feeling like this is similar to my experience of working overseas. So that really made me sort of realize that I can do this here, right? Like there's poverty here. And the idea of maybe upskilling or improving the lives of individuals and communities in the United States just felt like I could connect more with it because, I'm in America. It's where I grew up. And as much as I associate with being from India and my culture, I just really felt that I wanted to do the work in my backyard. It also, I think I had a little bit of an edge of like, I can't believe this is like this here. I don't know if you guys have felt that way before.
Yeah.
But yeah, it's like, wait, there's an injustice there, right? You feel it when you go abroad too. Like I remember in India feeling like I was in some of the, what do you call it? The shanty towns in India. I remember seeing like little kids that could have been me, right? And so you have that connection of like, wow, right, what happened to my opportunities and why did I have something different? So wanting to do something about that. So that took me to Chicago, and I worked there as an epidemiologist, which wasn't my background. I did my master's in population and family health. So as you know, the public health degree is so vast, and then you're asked to specialize in one area. I think the doctorate's actually even, you have to have this broad education. It's kind of like sometimes I think of it as like a lawyer. You don't ever specialize, but you do this like long, this broad thing. And then, so I was hired as an epidemiologist, and I actually told my boss, I'm like, please don't call me that right now because I don't feel comfortable with it. After 10 years, I felt very proud to be a senior social epidemiologist. And that also was a new concept. I think most were trained in epi with clinical training, and the idea of social epi was evolving at the time. This was in the early 2000s. Yeah, and that took me to, an amazing experience. And that journey of 10 years allowed me to work with communities, empower communities with data. We did a lot of gathering of local data. I was able to publish, and talk about mentorship. I had an amazing boss, really. And he's a lifetime friend and mentor, and his influence on my life has been tremendous because I learned so much from him. His name is Dr. Steve Whitman. Yeah, and so then I felt a little bit more confident and empowered, and I, presenting at APHA every year. That took me to doing some policy work, because all of the data and findings that we had and all the publications, I realized that we can actually use this to influence policy, similar to what SAPHA has been doing, right? And that took me to LA with a job at the Center for Health Policy Research. Yeah, and then I dabbled with the government, working with community health workers. I left my Center for Health Policy Research job mostly because, my mentor had passed away, and being in academia with a master's was a little challenging for me. I don't know if others have had success, but I found it a little bit hard to grow and take on my own research there, even though I felt confident in doing it. I think without the degree, it was a little harder. So I went into government, which I found to be a little bit more open. So for those of you that, I think government, especially at counties where you're in a safety net system,
Right.
There's so much innovation that you can do. And so I found that I didn't necessarily have to prove myself with a degree. I could just do the work. And I'm much more of a doer, I think, personally. I like to get things done and make sure that it's working. So there I got more opportunities. And we embedded community health workers for the first time into primary care, which was new to the Department of Health Services. They had health workers in public health. So those of you that are, might be familiar with community health worker programs, it's growing quite a bit now. This was in 2015. So the county had, for the first time, actually hired community health workers, part of the health services team, to deliver care and sort of be the eyes and ears of high-risk patients in their homes and bring that information back to the county. So that was really exciting, actually. I was very, very excited about that and proud of that. And then I worked in their Office of Patient Access doing business analytics. I sort of kind of dabbled in a lot of different things, total windy road. And I think the one theme I would say I have experienced or felt was just this connection to community, putting the patients first. I think one of you mentioned that you're in patient advocacy. I think that healthcare is changing, and the more we bring that concept, and I personally do think that it comes from being South Asian, knowing that you put people first, right? Like the connections that you have with the fact that you have community and family around you as part of who you are is instrumental to health. And hopefully our entire health system can start to really appreciate that. I don't think it's just South Asian. I think a lot of different cultures do value that. But our health system is just not set up that way right now. So anyway, long and windy road.
Story. Sure. Yeah, it's such a fascinating story in the sense that also, you began saying that in the beginning, you weren't even aware of this field of public health, and so much has evolved in the last few years. Well, now it's an undergraduate degree. It's something that really applies to every single aspect of our lives and is so applicable. And so that's so amazing to just hear how your journey, even though a few years ago it was a situation where public health was an unknown, now it's something that you've dabbled in every single aspect of it, from what you were describing, from community engagement and the data angle, being able to support population health outcomes, being able to work within the government. And so I'd love to learn more about, from that. And you talked a little bit about your, desire to be embedded within community and give back to the community in different ways, even in your own backyard. How did that lead you to SAPHA? Was that a part of it?
Yeah, I guess so. We were, I joined SAPHA when the local chapter, I think we had discussed at the time, there were these local chapters. So I was in Chicago, working with other communities, right? So working predominantly African-American and Puerto Rican, Mexican communities, and actually adapted these health surveys to the Vietnamese, Cambodian, and Chinese communities. Wanted to do South Asian, and I think this is something, working in the South Asian community, it was so diverse, right? And in Chicago at the time, geographically, it was so spread out as well. So I ended up, my connection to South Asian community, I've always had that personally. And I guess I was drawn to the local chapter and started working with individuals that are in the communities there. Um, we built out there was a mental health conference that we had, just talking about issues that really nobody else was talking about. So, we were all interconnected. Chicago's pretty small community in the sense of like people know each other. We're always supporting one another. I felt like I was growing quite a bit. We tried to do these health surveys in South Asian populations. And again, like I said, it was a little bit challenging because it was so vast, right? Like, how do you get a sample of a South Asian population in a broader community like that, right? When you don't have as much money. We were looking at different sampling frames. So a lot of discussions, but I was engaged with the South Asian local chapter basically. And then through that, there was a need, there was a gap. The treasurer at the time, Mayur, had unfortunately passed. And so some folks asked if I'd be willing to step in. So I joined SAPHA through that as a treasurer. Mind you, I'd never had any experience in that, which is why it was so great for me, because SAPHA allowed me to learn a lot about this. I had to learn on the job. I think that's the one thing about joining any nonprofit. You've probably heard this theme before, right? Like anytime you're a small group of people trying to get stuff done, you just kind of do it and figure it out, learn on the job and get things done. So SAPHA availed me the opportunity to learn about the taxes and streamlining that a little bit, some of our budgeting, how do we even manage the funds that we had, how do we grow from there? So over time, I then became the president, again, mostly because I just felt like there was opportunity to like lead this organization into something bigger. I want to say at the time it was sort of, you guys have done such an amazing job, honestly. Like in the last couple of years, I've seen the growth and just the caliber of the work has been like, it's really getting to a place where it's like professional. I think our group was still in SAPHA Yahoo groups. Like we were still working on getting stuff going and establishing ourselves. I think over time we did. The SAPHA local chapters was a really unique concept. We were trying to figure out how do we engage with people without, nationally it's really hard. So can we get these local groups together and what can they do? And that way it gives the local chapters or these local communities ownership over what they wanted to do. So it started a bit, again, like I think the Chicago chapter was doing some interesting work. We did have that one conference. I'd have to think back at what other work we were doing. But that's really how I got into the national chapter. So yes.
Yeah, that's amazing. It's the fact that like you started off just with the local community and made your way up to the national level, which is, for us, as we have been talking about, what does that look like? And so it's nice to know that, like local chapters worked back then with the Chicago group, especially. And, it's your time with SAPHA, as you were talking about some of the foundational stuff that you all basically contributed to, right? SAPHA has its success now because of all the work that everyone put in many years before. And so we're eternally grateful for that foundation that you helped build. And so it'd be interesting to know, how did your time with SAPHA and the work that you did influence, what your next steps were in your careers after you left SAPHA? And just as you were working along, what was some of the biggest lessons that you learned or something that you wish you had known when you first started your journey?
Yeah, I wish I knew how to do treasury work, honestly. And taxes. But let's see. SAPHA for me was like it's just part of what we were doing. Like it was so easy to transition into that. And I would say what I learned the most was, in addition to all the sort of how do you build a nonprofit, how do you create a governance section, how do you create a board that's not just governing but actually doing work. I learned a lot from the people that I worked with, honestly. Like, our board Jane was amazing, Amuna, Hasneen, Bindu. Like, I think just as you guys have said, and I've heard repeatedly, like what a small group of people can really do to like galvanize communities. I would say that one of the things I most like when we were at SAPHA, the APHA, one of our APHAs, we had the Surgeon General come, and we had this great meeting where, we talked about all the different issues that we were seeing. There was a big component around mental health, I remember, that was pretty strong. So what did I learn from, I guess, just learning how nonprofits work? I mean, I've never run my own nonprofit, or like, not that I ran it, but like even how it works, right? I think I learned a lot about leadership too, like how do you inspire people and not necessarily have to do the work yourself. Was really more about guiding and facilitating. I think something that you're obviously doing really well as president. Learning how to hand things off. How do you make sure that people have the same vision? I wouldn't say I was so successful at that always. I think there were some people that maybe had their own agenda. And that's okay. I mean, it happens, right? Everyone's, especially, I didn't have a research or a PhD. And I think when you have a PhD or in research, you're kind of always working on like, what's your project and research project. And so I think it's a little different coming from academia versus working, either for another nonprofit or working in government. It's slightly different ways of working, right? You're not dependent on funding when you're working for the government. You're not dependent on your next grant. And so that is a different mindset sometimes. So I think I learned a little bit about how that works and how that's different, because each of us on the board was a little different. And then also how that had implications for SAPHA moving forward. And I think I took those lessons just to my work experience, and also just, to the world. I mean, honestly, I think the connections that I made from SAPHA were probably my greatest gift, and continues to be. I mean, I just love people from SAPHA. I mean, you've met Arnab, right? Like he's like the mayor. He's like the SAPHA mayor is how we call him. We all love Arnab.
Putting it.
I think there's a connection there. And I think it's part of what, if you look at populations in the United States that have been successful, like if you look at Jewish communities or other communities and how they help one another, I think that's what SAPHA has been doing. And it's growing. We have to always help one another. And even if it's someone who's not South Asian, right? You just want to be able to be a resource to support good health and continue to grow in ways that you'd want to see our world be.
That's awesome.
Question, yeah.
Yeah, but what you said about the diversity of the board, and you at that time you did not have a PhD, or there was different folks working, some in research, some in academia, in different fields. That's so much of how the SAPHA board is comprised today. Everyone comes from a different background. We have researchers, we have consultants, we have project managers, we have folks who are clinicians, people who are actually running their own nonprofits in addition to being involved in SAPHA. And you mentioned that the connections are one of your favorite quotes, and I think that's so significant to what we have also seen and what I've seen. So much of one of my favorite quotes is, once or twice a year, our board will get together and just talk about how we can grow SAPHA and what our ideas are. And I feel like every time we do that, it just inspires us to be able to do more. And over the last 25 years, SAPHA has done quite a bit, made quite a bit of accomplishments, many in no small, part due to you and your leadership and your team's leadership when you were on the board. And so some of those milestones are, obtaining the 501c3 status, publishing influential research like the Bond paper, The Health of South Asians in the U.S., which you were the editor of the very first issue, receiving prestigious awards, forming critical partnerships, advocating for health equity, and actively addressing evolving health needs within the South Asian communities. The impact of SAPHA has extended in the last couple of years, especially to legislative advocacy, such as advocating for the South Asian Health Awareness and Research Act, participation in national health campaigns, and establishing a noteworthy presence in DC, marked with engagements with the Secretary of Health, invitations to the White House, active participation in key conferences, continuous efforts to really address health disparities and promote equity in South Asian communities. And so, given all this, I'd love to hear from your point of view and perspective, where do you think SAPHA can be impactful if we look ahead to the next 25 years?
Mm-hmm. Well, first of all, amazing work. Congratulations on that. Like I had learned a little bit more about that as I've been reading some of the newsletters. So tremendous effort to get into the politics space and push for policy improvement. I was thinking about the 25 years to come. That's a really big question. First of all, I think it'd be amazing to try to understand the South Asian experience in America. It's so diverse. South Asians alone are so diverse, and then their experiences in America, right? Like when you come to this country matters. Understanding what that experience was in this country matters, like your identity. I don't know what the new generation, like when I was in school, I was very proud to come from India, but I met people when I was in college that were like changed their names, were not very proud of identifying with being South Asian. I don't think that's the same anymore. I think we see more of our faces on TV. I think we are much more into mainstream. People are really excited about things from India. So there's a little more acceptance. And at the same time, I think there's still a need to be able to say, what do we bring as a South Asian community to the fabric of America? And how can we not just influence to be like, oh, we're South Asian, therefore we must do this, but how are we like, we're from South Asia, we bring this gift, right? We bring these different cultural lessons, and how do we then improve and make healthcare delivery in America better? How do we improve the way public health is experienced for all Americans? So I would love to see how we not just influence for our people per se, but for our people collectively as Americans. Because I would love, love, love for people to understand what it means to age, right? Like I'm right now dealing with my own experience with aging in America. And I wished it was more the way people used to age in India, right? I don't even know if now that's the case, but 20, 30 years ago, where people have joint families and you're able to age collectively, right? Like, so I think I've heard of some South Asian retirement homes or nursing facilities and so forth, but this is one example, right? Managing a chronic health condition, right? How do we change the way we maybe change our diets? How do we influence both ways, I guess, is something. So I'd love to see in 25 years that it's South Asian public health, but it's also South Asian public health as part of America. I think that's something that would be really important. And the other, I guess, is the unity and diversity. Like, I think sometimes South Asians can be like, well, I'm this or I'm that. And I've seen that divide happen even among other ethnic groups. I mean, OMB just changed the way we're collecting data on this. How we're seen is often how we're being identified, but that's not always how we are, right? Like, if that makes sense. Identifying African American, for instance, is a really big challenge too. It's so diverse. Like, what are we calling people as opposed to seeing people as people? Because you can grow up in a different community and really just feel like that's what I am, right? And I experienced that, like I said, like there were kids in my school, right? His name's Azim and it goes by Jack, right? Because that was his identity, and yet he had no connection to what he grew up with, or what he had experienced was a negative connection. So you change that because you're like, well, I don't want to be undervalued, so I'm not going to connect with that. And instead, sort of being proud of where we come from, pulling the good lessons from both sides, I guess. And I really do believe that there are gifts from every culture, and if we are able to take those lessons and bring it to a broader culture, would be really amazing. And public health does have a lot to do with who we are as a people, not just the health care, but rather health of the individual and their well-being. And some of that has to do with your identity and being able to associate and connect. Yeah, that makes sense.
Yeah, no, it's a very good point. I mean, our identity is so integrated into how we even just take care of our health and how we approach the concept of health. So those are very valid points. And I know you've led many great projects and initiatives during your time in government, but you just recently mentioned that you made the significant decision to become a full-time caregiver for your mom. So would you be able to share, what influenced this decision and how it impacted your perspective on South Asian health and caregiving, which I know you alluded to before as well?
Yeah, I mean, it kind of goes full circle in some ways. So one, I think you also asked about career trajectory. So I left my government job to go to a nonprofit because my parents lived in New York and I lived in California, and I could not travel back and forth.
Mhm.
I could do FMLA, but that sort of takes you away from the work itself. Like you basically have to just take off. So I went to a nonprofit. It's called Movember, and I was able to work from New York, which is why I took that job. So I was there for about a year and a half. I recently left because my mom's health has declined even more. So I really needed to be in New York, just like more, I have to be here. So, and I realized that the demands on my personal life and work were just, I was at this crossroads of like something had to give. So yeah, I ended up leaving my job just about a month ago, and I'm now home full time. It's a personal choice, right? I think caregiving is really important to me. Like I want to be, so I don't even call it caregiving. I just want to be here for my mom and dad and spend time with them. I think I was alluding to, like, I think back at the way nuclear families are, and I think many families, like I happen to move away, right? If you live close to your family, it's convenient as people age. You don't have to then recreate your life. So, I'm kind of recreating it at the moment. And it's working. I think I've been fortunate enough to be able to get some contracting work based on my experience. And people have come back to me like, oh, if you can't hire you full time, can you work on this project for us? So that's hopefully we'll, move into being able to do that part time, and then also so I can maintain my career, one, and have a little income, and then also be able to take care of mom and dad while I'm here in New York. So.
You mentioned, early on in the conversation, you mentioned the concept of joint families and how, in India, it's such a common thing. In the US, it's, very common as well, but certainly not as common as it is in India and other countries within South Asia. So I'm curious, from your perspective within the South Asian community, what unique challenges or cultural aspects have you encountered, or have you even seen in the past, and how have they shaped your thoughts or even your approach surrounding the concept of caregiving?
Yeah. So I'll tell you, when I went to India in 1995, right out of college, I spent about 9 months there, and I lived in a joint family. I think it was pretty common there at that time. Over the years, my aunt actually started what they call a gardagar, which is like a home for the seniors. It was one of the few in rural Gujarat. And it was because so many families, that nuclear family was evolving and the joint family was breaking down. So I think Westernization had led to that. So more and more nuclear families were evolving. I grew up with my grandparents in my home, and I myself am a product of that breakdown, right? Like I moved away because it was like, it's what you did. Go away to college, go here, move, do your own thing, right? And that's what I mean by this cultural phenomenon, right? Like in America, it's all about, it doesn't have to be, but I think that was the experience I had, was like, go be in, do your thing, that I idea. And I always think about the we concept now, like, and that's, I hope, it's a cultural thing that I think you get from being South Asian, to think about your community, think about others, and hopefully we can bring that back. I do think maybe there's a reversal going on now. I think younger generations are living at home more, maybe because it's harder to find housing. I'm not sure. But I do think that breakdown of the joint family to the nuclear has evolved, and hopefully maybe we'll return back with the influence of having these types of global images, the global things coming back. I think that global to local is another area that I've been working on. And how do you take concepts from India back here in the good, right? We lost it. I think in India today, I don't know how many joint families there are anymore. I think that'd be something to look into, but I have seen that breakdown, and mostly just, like I said, my aunt had started a gardagar because so many older people, like all her friends, like they didn't have anywhere to live. So, and she was a widow herself. So she was living on her own, and she realized that her peers were being, I don't want to say kicked out, but they were not being taken care of. And so they built this facility, and people went there to stay, kind of like a senior home. So, for good or bad, but you see the need and then you try to meet it. So hopefully we can bring back the joint family. I think there's value to that. So I don't know.
Yeah. I mean, it's a very good point. I think a lot of people nowadays are also grappling with that as, their parents are aging and just existing in the US as a South Asian, where you have that, I think, tension between your cultural influence and your, the Western influence. And I know definitely for myself as well with like aging parents, it's definitely something that's at the forefront, right? How do you balance everything? How do you balance your professional life and your caregiving duties? And so, what advice would you have for other South Asian individuals who are also in that same boat, right? Balancing professional responsibilities with caregiving duties, or just being there for your parents and helping them as they age, especially while navigating some of the cultural expectations, both on the Western end as well as the South Asian end, and pressures that might come with this.
Yeah, it's hard. Um, I think having a community and a village really matters. So if you're able to build that and have that with you wherever you go, um, it'll help you manage the cultural expectations, if you call it that, or I'm hoping it's more expectations that you want for yourself. So I try to take away, I mean, I'm definitely way that, like I'm a South Asian woman, like as women, I think I have also experienced that, like, oh, should I be doing this? Should I be? But I've often taken that out and been like, okay, this is what I want to do,
Hmm.
right? Like, yeah, people might say, oh, of course you feel like you should take care of your mom and dad. I'm like, yes, and I really want to, like, that's where my heart is. Um, so being able to be true to yourself that way, I think allows you to thrive and continue to feel good about yourself. And um, the balancing is hoping that you have, family that understand. Um, Everywhere I've gone when it comes to work, they've always said family first, right? Like I've been fortunate to have colleagues that have also supported that. And if they don't, then I would probably just leave because family does come first.
Yeah.
Um, and work too. Work will always be there, is how I see it. I think if you're able to be creative and think about ways to do work in different ways, right? Like how much time do you really have? What do you really want to do? And how do you want to maintain that? Whether it's as a consultant, part-time, full-time, I think those in academia have a little bit more flexibility. I think sometimes that can be, it just depends on the demands of the job, really. I think the government also avails some flexibility if you're local. Nonprofits, obviously, as I've gotten, I think with any career, most of you probably know this, so forgive me if it's a repeat, but in the beginning, you're doing the work and you're really getting good. You're like developing skills, and it's so rocking awesome. Like I just loved doing the work personally, for me. And then eventually I got into like management. So then I'm like supporting others to do the work, and I'm like training them and supervising or whatever, like coaching. And then you become like a director, and you're really just kind of monitoring a lot of things and watching how things kind of grow. And you're actually removed from the work, believe it or not, which sometimes sucks, honestly. Like I missed like doing the work, getting my feet wet, getting in the weeds of the data. But now I'm like, God, if I had to like pick up SAS and do a code right now, I couldn't tell you. I don't remember anything. So that's just, I think, the evolution of your career. Some people, I mean, not everyone, but certainly for me has been the evolution. And now all of a sudden, when you're at that director level, there's a lot more responsibility. You have a lot more time and demands, right? Because you're putting out fires everywhere. So kind of going back to like, okay, how can I now take a deep breath in of that whole spectrum? Where do I want to be? And can I just get a slice of it so that I can have work-life balance and just do a little bit of what I love to do of that whole thing, of that whole like spectrum of types of work you could be doing. So I think if you're thinking about work-life balance moving as you're thinking about like, oh, I want to have kids, I want to do like, what piece of that is something you still want to do and allows you to have that balance? So I think in public health, the nice thing is that you do get a whole broad array of skills, and then hopefully you can pick the thing you want to do at the time that you want to do it.
I love that theme that you just shared with us about, making sure that you can really prioritize what's important to you and still balance it with your work. And, your journey has shown us that there's many ways to be flexible. There's many ways to learn and dive deep and have so much experience and being able to balance that while still being able to balance your personal responsibility of, caring for your family, for being with your family, for being involved in the community and just being engaged in different ways. So thank you so much for being so willing to share your story. And thank you for being willing to share about your mom. We wish her well.
Thank you.
Public health has been, in the background for many years, and with the pandemic, it was suddenly in the limelight. And since then, the public health community has really faced a lot of challenges like burnout, significant spending cuts, mistrust in public health agencies. And more recently, we've seen people try to push back against work to address systemic barriers and work to improve equity. So given all of this, and as we close, what advice do you have to motivate the next generation of public health professionals to keep doing what they're doing and not lose hope in the impact of public health work?
Yeah, that's, I think helping people understand what public health is really important. I think there's a misnomer and sometimes this idea that it's like this, left-wing public health, I see public health very differently. I do think that public health touches all of our lives, and sometimes it's misrepresented by some populations. So if we're not investing in the health of our people, then we're not investing in anything really. I mean, there's a lot of money that's being put into healthcare. And I think our health system is incentivized as such. So in other words, the payers and so forth, right? You pay for services, or you pay value. There's more and more value propositions being done for value-based care. I think that's where the public health opportunity is. So I'm hoping that as things move forward, that we do start to turn that upside down. So that is the patient, or I hate even using that word. It's really that the individual is at the center of their health and not necessarily the health system. I've seen some talks where we're like, yeah, why are physicians should be working at the top of their license, addressing social determinants, as they call it. I was just reading an article about who's determining what the social determinants are, right? What is the concept that we're talking about really? And is it really just the root causes of ill health? And those root causes come from your home, the way you were raised, your community that you live in, whether you have a job, all of those other factors, right? The political structures the social structures, the radical, the racism that we see that has been institutionalized, the marginalization of populations, just the marginalization of public health, and sometimes, right? With COVID, right? There was this, don't wear a mask, right? There's marginalizing of things because people don't understand the impact that people have, that these policies can have on health. So I think that would be really key, so that it's not so, it just feels like there's such polarization going on. So the politics have played a role in the way we see the health of all. And if we start to unite a little bit more in terms of this impacts everyone, I think I'm hoping that argument will be less of a us versus them and more of a we all are impacted by this. I'm talking broadly, but I do think that that's something that I hope for the future of public health.
Yeah, that's great. And I think hopefully a lot of the, upcoming public health professionals that are listening to this really take that to heart and work towards having more of a unified approach to public health. I think it's very necessary as we try to combat some of the polarization and the politicalization of public health in the upcoming future. So thank you, Ami, for taking us on this incredible journey through your experiences and your insights. It's been an honor to have you as part of, a guest on the SAPHA Spotlight series. And to our listeners, thank you for joining us on this milestone episode. Stay tuned for more conversations with past SAPHA board members as we continue to explore the career progress of individuals who have paved the way for change within the dynamic world of South Asian public health. Follow us on YouTube and Spotify by subscribing to our channel. And if you enjoyed this episode, please consider donating to SAPHA at www.sapha.org. Until next time, this is Samira and Aisha signing off. Thank you.